I think one of the things that we need to recognise here is that the new variant of the virus spreads more easily, and it has put significant pressure on the NHS, as I think the PM said recently. So that the additional pressure on the NHS is really very palpable. We have about 30,000 patients with COVID in our hospitals, and that's beginning to come down, but that's still about 11,000 people more than the busiest day in April last year. So, I mean, it really is noticeable. Our colleagues in hospitals feel it. Our colleagues in the community and general practice feel it. So it's really important. And I know people keep hearing this, but it's so important that we follow the guidance, stay at home. And when we go out for those very few but important things, our food shopping or whatever, a bit of fresh air, following the guidance very strictly, hands, face, space, because that's what we need to be doing right now to help those rates come down.
You mentioned supermarkets, but there are other vectors of transmission. Where are you most likely to catch the virus?
I mean, really, it's anywhere that is indoors. That's our biggest risk because it's airborne. So if you're going outside for your daily walk or run, keep well away from people. Staying in the fresh air really is a better place to be. Anywhere where you're indoors increases the risk significantly, especially when there's poor ventilation, which is why we say please stay at home as much as you can. That has to be the safest place right now.
So it is clear, isn't it? If you go even to a supermarket, you're increasing your risk.
Absolutely. And this is why we say, really plan your visits so that you're not going in and out of different places every day, where you're able to have your food delivered. That's really helpful, whether that's through a volunteer or a member of your community or through some of the online portals. And that keeps you as safe as possible. But look, we all really I completely understand people are getting tired of being in lockdown. So going outside for that fresh air every day is important. It's the vitamin D, it's the sunshine. It's really important for all of our mental health. So please do that. Just do it safely.
Do we have a sense of the sort of demographic of who is most likely to catch the infection?
I mean, what we really understand very well is that the people who are most at risk are the people who are on the JCVI priority list, in line for the vaccination. Because what happens with this virus is it really disproportionately affects people by age. And we know also by other conditions and by wider factors, including ethnicity and deprivation. So, what we need to do is make sure that we protect our most vulnerable. And that's why the vaccination programme has really been directing vaccine under the instruction of JCVI to those who are most vulnerable, particularly those in care homes and those who are older in years. Because what the vaccination does is prevent hospitalization and death, which is absolutely crucial right now when we have the sort of pressure that I've just described.
What impact did Christmas mixing have on hospitalisation levels?
Look, I mean, Gloria, I'm a GP. I'm not an epidemiologist, but what we do know really clearly is that at Christmas we had 18,000 patients in hospital with COVID, and we now have around 30,000. So we know that, particularly because of the new variant, we have an increased pressure, which is sort of fairly consistent over parts of the country.
Are there enough NHS staff to cope?
Our NHS staff, look, I mean, this is my moment to say a huge thank you to our NHS staff. This has taken an undescribable toll on them, on their families, on their mental health, and yet, Gloria, they keep going, and I am blown away every day. Whatever part, whatever sector of health and care that our teams are working in, they keep going, and we are amazed by them every day. I am very grateful for the fact that they have, by and large, because of their prioritisation for the vaccination programme, had their first dose. It's really important that we recognise the impact that this has had on our staff mental health. And we've put in mental health support nationally, and teams have done so much locally to make sure that staff can get support one another. I think one, glimmer of light there is the vaccination program, because it has been incredibly, I think for me it's the most rewarding thing that I've been part of in my career, and probably that I'll ever be part of, Gloria, because the hope and optimism it gives to your local community, to your teams. I was hearing from somebody yesterday they've set up in a theatre in Barnet, and the local community have provided them with these giant samosas. They looked incredible, and on the stage they've got people doing little skits and everything. So there's a little bit of entertainment, and people are cheering as people get their vaccination. And after the incredibly challenging year we've all faced, those are the moments I think that are going to sustain us over the next few months of the programme.
And how close are frontline NHS staff to being vaccinated themselves?
They already are, Gloria. It's been really great uptake in staff. So predominantly the vaccine for health and social care staff is through the hospital. So they've been responsible, the hospitals have been responsible and doing a great job in getting into communities and and making sure that staff are invited in for vaccination. But actually our general practice teams as well, we have them all across the country, and they've been very, very much open for vaccinating their colleagues, their staff, as well as their patients. So we've been saying, whoever you are, you could be a locum, you could be on a bank list, you need to access your vaccination because it's our important way of protecting yourself from hospitalization and death.
So any frontline NHS staff worker can get a vaccine at the moment?
Absolutely. So it's frontline NHS worker and social care worker. So it's really important that our social care staff are protected, and also our care home staff, because they're part of the care home team, and that's to really, protect them and to protect their vulnerable residents as well.
And they should all be vaccinated by mid-Feb?
Absolutely. Well, we will have offered the first dose of the vaccine to the first 4 priority cohorts by the middle of February. And, we will keep offering it, because sometimes, and for some people, they need to hear the offer a bit, talk about it with their local family, their community, and then decide to take up the offer. So it doesn't mean that after the middle of February you can't get it. We will keep going with this. We will keep making sure that not just our staff but our residents are protected when their time comes.
The vaccine does seem to be going well, but there are some stumbling blocks, like Black and minority ethnic members of the community. What can be done to increase take-up?
Well, that's a really important question, and it's something that I think about every day, many times a day, actually. We are seeing what we describe as vaccine hesitancy, so concerns about the vaccine more in ethnically diverse communities. So there's something that we can all do here. We've all got a role to talk about the vaccine, to learn the facts about the vaccine, so that we can be really clear that, for example, the vaccine has no meat and particularly no pork products in it. It has no alcohol in it. It has no fetal cells in it, and it's fully endorsed by the community and faith leaders that we've been working with. And so at a national level, we've been spending a lot of time with fantastic community and faith leaders who are then helping their constituents and their congregations to take up the vaccine. But at a local level, it's really important that when you've had your vaccine, you talk about it too. It might be telling your neighbour, socially distanced or on the telephone, that you've had the vaccine, that you believe that this is the right thing to do, because that helps other people take it up. And I was in a care home recently, and I was talking to a care home member of staff, and we were going around the home vaccinating residents. And at the beginning, she'd said she's not going to have the vaccine, and her family isn't going to have the vaccine. And through the course of our time, as we went around the care home, we discussed the different things, like the things I've mentioned that she was worried about with the vaccine. And we talked about the fact that the risk of COVID is far higher, far higher than the risk of the vaccine itself. And at the end of it, Gloria, I had one dose left. And just before I left, she came down and she said, I'm going to have it. And she is a member of the Afro-Caribbean community. She has diabetes. She's in her 60s. She's a care home staff member. And I tell you, nothing has moved me more, and I don't think anything else will, because she said, I'm going to tell my brother now. And he is he works in the community. I'm going to tell my family. And I thought that is the sort of thing that ricochets. So whether or not you've had your vaccine, please talk about it. If you've had it, and particularly if you're a member of an ethnically diverse community, please talk about it. And I think communities have a strong role here. So the Asian Standard in, I think it was in Lancashire, did a whole front page spread and did all the myth busting. And I thought, how fantastic. And we've had Asian celebrities put together videos, and MPs from Black communities put together videos. This is the time for us to come together and make sure that all of our communities feel confident taking up the vaccine when they're ready to do so, or when they're offered it.
Okay. Do we know if vaccine immunity will last long enough to protect us come this winter?
That is one of the hardest things to predict and understand. We've still got a lot to learn about this virus. We know that it is deadly. We know that our vaccine program is our best chance to come through the virus and the pandemic. But ultimately, we need to learn more about virus transmission. So what we know is that the vaccine protects us against hospitalization and death, and we will be learning over the coming months about virus transmission. And at the right point, the chief medical officer and his team will advise the government to make the decision about when the immunity is lasting long enough, and when we will be able to come out of our current situation. And, we think that we will have to do, we've done the first dose, we'll have to do the second dose, and we might well need to do this as a yearly program, a little bit like the flu program, because of the way the virus mutates. But as I said, we're learning a lot every day. It will take us time to deliver the vaccine, but just take it when you're offered it.
Okay, we've ordered a lot of vaccines. We'll undoubtedly have a surplus. I wondered what your reaction was to the World Health Organization, which has urged the UK to pause the vaccination programme after vulnerable groups have received their jabs to help ensure the global rollout.
Look, we are only going to beat this virus when the whole world beats this virus. I think that's clear, and we all have a role internationally to make sure that that happens, because we all need that protection and we need to look after each other through this. So I think, look, we are part of an international sort of effort around this. I think we need to see how supply flows, and what happens around supply, and then obviously that's a government decision, and I'm sure they'll be making those decisions as soon as they can. But this is absolutely an international effort.
There's been a war of words from some EU leaders on the efficacy of particular vaccines. Has that transferred to those turning up to get the vaccine, asking more questions about, for example, the Oxford vaccine and its efficacy?
Do you know, not so much, Gloria. What I'm still finding is that people are just overwhelmingly relieved. Actually, I think relief is the right word, to be offered the vaccine. There's a little bit of, should I have this one? Should I have that one? And most of the time, both are exactly the same. In terms of protection, so we offer what we have available. But actually, and a huge thanks to the public. You've been incredible. You've come and you've supported your vaccine centre. You've taken your vaccine, and actually, I have been blown away by images of people getting sent in food and support packs and notes saying thank you for the vaccination. But very much less so about which vaccine is it. People just are thankful to have their dose.
Dr. Nikki Kanani, thank you very much indeed for your time this morning.
Thank you for having me.